Usva, that's a Dilvaranium, Varko Devasya Dimihi, Dioyona Prashota. Between 1,000 yesterday and a million tomorrow, there is only one today, so don't let it go waste. With this wonderful quote, I start this wonderful session. On behalf of Ayas Kayush and our streaming at Vaidya Grama Coimbatore and sponsored by Dr. R. Ramesh, Daya Ayurveda Treatment Center, Madurai. Myself is Roshni from Government Ayurveda Medical College, Kotar. Today, we have a second session on Ayurvedic management in Pratishyaya, wonderfully enumerated by Dr. M.D. Vijayaragavan Sir, Reader, Department of Shalakyatantra, Sri Sairam Ayurveda Medical College and Research Center, Chennai. Sir has completed his BAMS degree from Tamil Nadu Dr. MGR Medical University in Chennai and pursued his MS in Ayurveda, ENT in Ophthalmology and Surgery from Rajiv Gandhi University of Health Science, Bangalore. Sir has been Medical Director for V3 Healthcare Limited, Mudachur, and Chief Ayurvedic Surgeon and Consultant in Sri Sanjeevi Clinic, West Tambaram. Also, Sir is a Chief Ayurvedic Surgeon and Consultant in Vikash Clinic, New Peringalatur. Chief Ayurvedic Surgeon and Consultant in Ambika Herbal Care. Sir has been as a for Ayurvedic Association, Tamil Nadu. There has been a wonderful medical life advisor in PNB Medical Life Insurance and also Kotak Life Insurance. Sir is working as a medical advisor in MI Labs Pharmaceuticals, Bangalore. He is a former member of Board of Ayurvedic Academy, TN Dr. MGR Medical University, Chennai. Sir has been a former hospital superintendent of Sri Sairam Ayurveda Medical College Hospital. Sir has participated as chief guest and special speaker in News J Television Corona Kelvigal Ayiram program on 19 June 2021. Presided over as a chief guest and a special speaker in Corona Awareness webinar organized by Women's Self-Help Group Mudachur on 10th July 2021. Sir has presided a wonderful event on awareness of Omicron at SRM Baliyamai Engineering College by July 21, 2020. So, Pratishyaya. Pratishyaya, which can be correlated with rhinosinusitis, is experienced by many, simply many, even me. Actually, the ratio goes as 5 in 10. We, the persons of the earth, are living in a polluted world, and this rhinitis is making the conditions for breathing even more difficult. Kafat kaso aruchihi shwaso vamatu gatra gauravam madhurya vadane kanduhu snikta shukla kafa srutihi. A wonderful sloka explained by Vagbhata in Ashtanga Hrudayam clearly explains the reason and also signs and symptoms of the disease, where our Western medicine says rhinosinusitis is a simultaneous infection of the nasal mucosa, rhinitis, and also an infection of mucosa of paranasal sinusitis. A distinction is made, a clear cut between acute rhinosinusitis and chronic rhinosinusitis. This may lead to nasal polyp and nasal deviation later causes as medical deviation. This is becoming more and more common issue with increased allergens in the air and growing even as a lifestyle disorder in many in the world. So now we are make aware of the people of this condition exactly. Now, for the practicing doctors and the budding doctors, here we go for a valuable session with the sir. With none other delay, I hand over the session to the sir. Sir, the session is yours.
Thank you, Doctor. Good evening, friends. It's a nice meeting. It's a pleasant evening. Nowadays, we are facing a lot of difficulties, especially in virus-related complaint and coronavirus or Omicron virus. Now, today's topic is about our Pratishyaya. It is a excellent, convenient topic, especially in Ayurvedic portion. It is correlated to in modern rhinosinusitis. This is my sir. According to next slide. According to Ayurveda, a good physical, mental, and social and spiritual life can be considered as arogya. That is the definition of arogya. The importance of Ayurveda, especially in the global scenario, is become because of its holistic approach towards a positive lifestyle. Because of that, we have very holistic medicine in all over the globals. Next slide. So once again, according to our Ayurvedic especially the good physical and mental and social, especially on spiritual life, can be considered as Ayurveda. This is a definition of Ayurveda. The importance of Ayurveda, especially in global scenario, it's because of its holistic approach towards a positive lifestyle. Preventive as well as curative is our motto. Next slide. So we know Shalakya is one of the important 8 branch in 8 Ayurveda branch. It deals about the disease which is manifested above the clavicle region, above the neck. Especially Acharya Sushruta, and it's only the only person who explained about the ophthalmology and ENT in this systemic manner in Uttaratantra in his Sushruta Samhita. So because of that, we got a separate branch and exclusive branch of Shalakyatantra, which deals about ophthalmology and ENT disease. Next slide. This our disease are Pratishaya. Actually, in Shalakya, it is very important disease, especially in Uttaratantra. Acharya Susura, which he explained a separate chapter for Pratishaya after Nasaroga Adhyaya. Then it is this fact it shows the Pratishaya has been a major problem in the physician even since long 2000 years ago. Okay. So that's why the Pratishaya are more important. Next. Uh, the ancient doctors which treats the common, especially the ancient doctor, they are treating the Pratishaya. But nowadays, probably is there an ancient, the efficient physician or Egyptian doctor, we treat the common cold even in the 7 days, but otherwise it cure its own. Because normal cold without proper treatment, it may be a person based on our immunity set. But if it is not properly treated, if it is continually recurring occurrences, it may be leads to Pratishyaya or rhinitis. In spite of the development of the healthcare system in all over the area, the common cold is still under the discussion. This is known as Pratishaya in Ayurveda. Next. Where there is a nose, there is a cold, there's a crowd. So because of the cold, it is named as Pratishaya, which persists all over the world in all human beings. Already Dr. says out of 10, 5% may be affecting Pratishaya. The history which is reveals that the Pratishaya existing from the 1,000 years ago, we call it a common cold, but in scientific manner, the Pratishaya it's named as rhinitis. Next. Uh, the Pratishaya is also mild disease. It can be the patient may, even though it's mild disease, but the patient extremely uncomfortable. We may experience and it's also the mild disease, but it can be the patient extremely uncomfortable, and also they feel irrelevant routine activities because of the cold. Then Pradisha is considered as a disease since 2500 BC, which is mentioned in our classical Ayurvedic books. All major texts, especially in Ayurveda, which is I mentioned about of the various aspect of this disease. Then Pradisha is IgE especially so it's a next. A simple common cold, nothing but Pradesha, which affects the most of the population. Probably the very few people may have been left, but if it is not properly treated, it is irritating disorder, which creates it's irritating. Unless it is not a manageable, it is not properly manageable. It may lead to several complications like chronic rhinitis, sinusitis, bronchial infection. Next. Okay. So once again, we see about the Pratishaya has been, which is noted very common disease, which is affecting any age group, even geriatric to pediatric, in all gender. It may, which provides worldwide, because the recurrence of the disease, which occur because of the dosha, would not be get evaluated from the completely from body. That's the reason. Because of that condition, we may have recurrent infection. Next slide. We know the common cold is especially the rhinitis. The definition once again will explain about the rhinitis. Is the inflammation of nasal mucosa membrane. Rhinitis. It's commonly known as running nose. We know that it is a medical term describing about the irritation and inflammation of some internal area of the mucosa is named as rhinitis. The primary symptom of rhinitis is nasal dripping. We know that usually lace of water is secreted from the both nasal or urinator. Then automatically it may leads to secondary conditions. Then it is caused by a chronic and acute inflammation of the mucous membrane of the nose due to the various like a virus, bacterial or irritant also it's involving. The inflammation of result which generating the excessive amount of mucus, which commonly which produce running nose, simultaneously as well as a nasal contraction along with the nasal polyps, especially in nasal posterior drips. The running nose is anterior, whereas some cases it may leads to posterior nasal drips. Okay. Next. So this picture is very clearly mentioned about the frontal sinus, ethmoidal sinus, sphenoid, and maxillary sinus. This, if it is a healthy condition, it may give more support to. It's not that it may affect that, which produce especially inflammatory condition of sinus or any obstruction in the opening sinus and fluid collection. These are the pathological condition of paranasal sinus. Okay. Next. We know what are the maxillary sinus. What are the, where it is situated, and frontal sinus and ethmoid sinus and sphenoid sinus. So the warming and moisturing, that's a very important function in this disease. This is pathological condition of paranasal. It very clear about warming and moisturing of the inspiring air, especially which is entering into the lungs before it gives physiological support to the air. Next. We are going to the word definition, Pratishyaya. That means it means the condition which continuously, Pradip is continuously flow out by that it is a recurrent attack. It is a recurrent attack and continually which is precipitated even due to the minute etiologic. One more thing, based on dosha, the vada is the main dosha, and kapha and pitta and ratta are associated doshas in Pradishaya. Next. Then the word prati, that a prefix which means adimuga or its towards or its direction of. Shayam is which is derives from the root of the Pradesh. So the meaning of this word is really clearly mentioned that the combination of word Pratishaya means it's almost continuous flow of thing from the body. That's the meaning of Pratishaya. This the condition in which kapha, which follows the vada, are coming out of the body. It is called as Pratishaya. The condition which kapha from the body is called as Pratishaya. Next. We commonly know that whenever the common cold is, sneezing is first, then heaviness of the head and stiffness is there, and pain all over the body. These are the predominant symptom and common cold of Pratishaya. or rhinitis. Next. Next. Uh, the rhinitis categorized, that's especially three categories are there: infective rhinitis, non-allergic rhinitis, and allergic rhinitis. Nowadays, allergic rhinitis more in suburban and urban region as well as in rural areas. So because of the natural calamities, we have more allergic rhinitis. Next, you know, the in spite of its achievements, the medical science it still doesn't have a cure about a common cold. The common cold is the minor, the minor illness which is caused by one of 200 different kind of virus, including rhinovirus and adenovirus. These virus can be causes when laryngitis, even bronchitis, because of its infection either in the larynx or in the bronchitis, especially from warm spots to lungs. The infection which are spread from the one person to another. Already, one of the example is like our coronavirus, and by hand-to-hand contact or by which coughing or sneezing, body fluids, it spread many virus to the viral particles into the air because of the uh, body fluids. Especially these virus does not respond the antibiotic. Already, the same scenario which is identified in the coronavirus as well as Omicron virus, because antibiotic it's not treated in this condition. Okay. Next. Due to the increased environmental pollution nowadays, busy life, and the rhinitis is a common disease in which the present era. Hello. Excuse me. Can you change the slide? Yes. So the continuation of the common cold in 1940, the Walter Kruse is a professor of German. He shows that the virus which is caused common virus, common cold virus, is identify the virus. And in United Kingdom, the Civil Medical Research Council is set up the common cold unit in 1946. In this unit, uh, the unit they are working with voluntaries who are affecting with various virus. Because of that result, the Rhino virus was discovered there in 1946. It is defined as very important. Then Pratishaya type. We are going to the types of Pratishaya. Acharya Charaka explained 4 types of Pratishaya except Raktaja Pratishaya. Whereas Acharya Susurda and Bhagavata are explaining 5 types of Pratishaya. We know that Vadaja, Pittaja, Kapaja, and Raktaja and Sanipadaja. Out of these 5, except Raktaja, other 4 varieties are explained by Charaka, Susurda, and Bhagavata. But the classification may be because of the age of the period of the Acharyas, it may differ. Next slide. We can easily understand the type of Pradeshaya based on the clinical feature and examination. We can easily find out it, which is a Pratija and with which a Kaphaja. Okay. Next. The specific it's very clearly mentioned in Vadaja and Pittaja and Kaphaja, Raktaja, Sanipaja varieties, the clinical feature, it may differ. We can easily identify the types. Okay, next. For the introduction, Vadaja Pradishaya, the obstruction to the nasal passage due to the inflammation. That's a easily clinical feature. We can easily identify that. But the water discharge from the nose is very excessive, and is excessive sneezing, and it may change the voice, and dryness because of the Vada. Dryness of the throat is common symptom in Vadaja Pradishaya. Next. But according to our Acharya, the symptom that is a clinical feature, the Lakshanas of Vadaja Parishaya, it's very clearly pricking pain, sensation in the nose, sneezing, watery nasal discharge, and hoarseness of the voice, and dryness of the throat, especially in palate, lips, and also the pricking pain in the temporal region, and dryness of the mouth, and headache. This important symptom, and another important symptom is ant moving like sensation is present, and it may be increase the uh, thickness of the mucus as well as the obstruction of the nose. Nasal obstruction is the end of the Vadaja that is almost Pakwa stage of Vadaja Pradishaya. We may have obstruction of the nose. Whereas in Pittaja Pradikapa, which is clearly mentioned, the clinical pictures yellow colored secretion, the warm discharge from the nose. It may feel hotness of the or the main symptom in Pittaja. So these are the that yellow colored, warm discharge, and hotness. It's the main symptom of the Pittaja Pradishaya. Next. As per our Ayurvedic texts, the Lakshanas of Pittaja Pradishaya, inflammation of tip of the nose. Because of Pittaja, fever occurs, and dryness of the mouth, and excessive thirst, and also hot and yellow discharge from the nose. When weakness may be occur because dosha prakopam, pallor, especially sometimes it may leads to vomiting, giddiness, and the voice changes also occurs. Next. In clinical feature of Kaphaja Pradeshaya, the white colored cold discharge. whereas in Pittaja, yellow color, whereas Vitaja, is white color, which is cold, not in hot, discharge from the nose, and heaviness in the head. They may have heaviness of the head, and also main symptom. These are the main clinical feature we can easily identify. Next. Our Acharya's opinion is in Kafajar at Pratishyaya, especially in the cough, anorexia, especially thick and whitish nasal discharge, and itching sensation because of the kapha prokopan, that is feeling of whiteness, especially whiteness all around the body, and heaviness of the head and face, heaviness up in the body, and breathlessness because it may obstruct the breathing passage, and also vomiting may occur because of the kapha prokopan, and also sweetness in the mouth, but swollen eyes, which we can easily find out these lakshanas and kapha pratishyaya. Then Rakta Pratishyaya, it's very clear, bleeding from the nose. Comparatively with Pittaja, Raktaja bleeding from the nose, there's a primary one, and so copper colored eyes, and also foul breathing face, a loss of sense and smell, and warming from the nose, especially the warmness, like flame from the nose, and also inflammation of tip and nose. It's also present in Pittaja, the same in Raktaja. And so thirst is there, giddiness is there, and it may be obstruct the nose. Yes. Then we are going to the Pratishyaya. Once again, it's very clear: bleeding from the nose, copper colored eyes, and foul breathing face, loss of sense and smell, and especially inflammation of tip and nose. It's the same present in the Pittaja, and excessive thirst and giddiness may. Next, the fifth variety, Sanipadaja Pratishyaya. We know the three dosha combination. Frequent attack of the common cold. It, nowadays, we may have a lot of complications in Pratishyaya. It may be correlated with Sannipadija Pratishyaya. It is a recurrent one, and frequent attack of the common cold is named as Sannipadija. Kafadi doshas, which sometimes which is separation, and also sometimes it doesn't separate. That means separation is the upper cone or pakon. It may differ based on the dosha predominance. Severe pain in the nose and head. All the symptoms like penis and all the symptoms of three doshas are present in based on the limited period, and above which explains asadhya if it is not properly treated. If you treat the sunny particle, we can easily prevent the patient. Then we are going to the Pururuba. The Pururuba, especially the Pratishyaya, they are very simple. Zero Gaurutum, we know that heaviness, which is a premonitory symptom, and sneezing, body ache, and generalized weakness. These are next. Once again, we are explaining common lakshanas of Pratishyaya. Because of the Acharyas Charaka, which gives the especially Samani Lakshana of Vijayaragavan, headache, heaviness of the head, loss of sleep, fever, cough, increased mucus secretion, hoarseness of the voice, anorexia and fatigue, or anosmia, this loss of smell. Nowadays, loss of smell is more common even in the coronavirus and so Omicron virus also. So this is another important symptom in generalized symptom of Pratishyaya. Next. We know the Samprapti of Pratishaya, according to our Acharya Susurdam, the Vada and other doshas either individually or collective. It may be two or three or four individual with or without association with Rakta, gradually accumulated on the head from the site. Then it is further into initiation with their respective existing cause because of its respective causes or it's stimulating the doshas, then which produce Pradesh. So once again, that the gradual accumulation of the Vadadi doshas, especially on head, when further initiation because of their respective executive causes, which produce Pratishaya. So this is an important scenario about the disease. Then Pratishaya is a Lakshanas, especially in various diseases. Like actually, previously we are dealing about this a disease, but even though it is disease, this is another scenario is that this is a symptom of other disease. This is a lakshana in the various disease like kaphajuram, or Vadasleshma Vichoram, Rajakshma, Apaja Jirnam, and Gragani, Kapaja Gragani, Arshas, Swasam, Tamaka Swasam, and also Kapaja Kasam, Kapaja Gulma, and Udavarta, especially Arthava Vedaka, and even though it's Krimi also is one of the symptoms. Pratishyaya is one of the symptoms in Krimi. Dosha Pratishyaya, actually the Pratishyaya means that if it is neglecting the cases, unavailable cases, or improperly treated cases of Pratishyaya, it takes a secondary condition, Dushta Pratishyaya, it is asadhya, according to Ayurvedic. But nowadays, if it is properly treated, definitely we can control the condition. Once again, the correlation between Pratishyaya and rhinosinusitis is nothing but RS. The inflammation of nasal cavity of paranasal sinus. This is an important definition about the rhinosinusitis. That rhinosinusitis is affected over the sinus, especially perforated, especially because of the inflammation of the sinus cavity, and almost all over the accompanied by the inflammation of nasal cavity. Rhinosinusitis is associated with a significant or negative impact on the quality of life and also high health care cost due to the medical visits as well as prescription over of the countries or medication. And sinus surgicals as well it may be missed days of working as well as schools. Okay, next. Then we are going to the complication of Pratishyaya. Already we know that the as of the Acharya, even though it's Asadhyatma condition of Dushta Pratishyaya, but Acharya Susara says all the type of Pratishyaya may leads to following if it is not properly treated. Then blindness, deafness, severe eye disease, cough, poor digestion, Agni Palam, especially swelling in the body, all over the body. So these are the complications if it is not properly treated. It's our topic, management, how to treat the Pratishyaya. Both Aushadha as well as Kriya Kalpas, we can easily treat the Pratishyaya, with the confidence. The Sikicha is divided into two, that's Samanya Sikicha and Visheshaka Sikicha, that means general treatment as well as specific treatment, based on the dosage. Samanya Sikicha of Pratishyaya, which according to the Acharya Chakrapani, the Pratishyaya is cured with the Langana, especially Langana Sikicha, within 5 days. Langanam Paramaushadam. Thus, even village side like very simple, they may easily control that because of fasting. Fever on the fasting, mild diet, which is already nowadays it's very clear. Thus, the 5 days of Langana, which advised in Pratishyaya before going to further treatment. Next. All types of Pratishyaya except Navapratishyaya, that is recent onset, should be treated by following Gridapana, Svedana, Vamanam, and Avapidana. These are the important therapy for in Samanya Sikicha and all types of Pratishyaya. Next. Sorry for the interruption. Okay, that's enough. So we have come to the conclusion about Sikicha. The Sikicha is divided into commonized treatment and specified treatment. Especially Samani Sigicha, all the types of Pratishaya except Nava Pratishaya, especially we treat the Langanam is the best treatment according to Acharya Chakrapani. If it is treated within 5 days, the patient will recover the condition. So that's the 5 days of Langana. It is advised in Pradeshaya before going to further treatment. It is very useful to us. We can easily control the patient. Okay. All types of Pradeshaya except Nava Pradeshaya, that means recent onset, should be treated by following measures. The 4 measures are there. Gradapana Sevanam, Svedanam, Vamanam, and Avapidanasya. Then we are come to conclusion about both statement. Next. Pratishaya, especially Pratishaya Siksha Sutra, on the basis of the above 2 statement, the first one is Langanam for 5 days. The second one is Gradapana Sevanam, and third one is Svedanam, and fourth one is Vamanam, and fifth one is Avapidanasya. So we can easily treat the patient even though it is Vadaja or Pittaja or Kaphaja type. Okay. Then if it is Apakva condition of Pratishaya, you can easily Svedana Karma is very important, and also intake of warm food contains of sour taste, and especially ginger, which should be mixed with milk and with sugar, can prepare a Pachana Karma, Pachana drug. Next, if it is Pakva, according to Susurda, the Pakva, especially the matured type stage, which the dense which is suspected by doshas which expelled out should be expelled. Then Susurda has been specifically mentioned in Vamana in Pratishyaya. Vamana should be treated in adult patient with a penis which is having excessive liquid secretion due to the Vadaja and Kapha. By the following measure, the Pratishyaya can be falsified. And next one. By using the following measures of Pratishyaya, that is Siro Virachanam, Virochanam, and Astapanavasti, and Dhumapanam, and Kavladraga, as well as Aritaki Sevanam, we can easily treat the Pakwa stage of Pratishyaya. We can, apart with the modern, we can classify the condition. Next. One more thing, in Crux, that's a banned laboratory medicine, which is very useful in this condition. According to Acharya, the Bhava in Bhava Prakashas, which is slightly differ from the above treatment. Maricha Churnam mixed with Guda, or the tea is actually with Katpala Churnam mixed with Guda. It also useful in the Pakwa stage of Pratishaya. In general pharmaceutical, they prescribe on medicine, sneeze cure. It is also very useful in this condition. Then Pakwa Pratishaya Sivicha, especially Chakradatta, which also mentioned the following measures of meaning of Pratishaya. Panchamula Siddha Grita, or Chitraka Aritaki, Sapikuda, or Sadanga Yusham, Veshadi Churnam, and Nasyam with Patyadi Tailam as well as Sadbindu Tailam. Next. Actually, Sushada, especially in Visesha treatment, specified treatment, mentioned about the treatment of Pradeshaya, Kadutikta Dravya Kritam, as well as Tikta Tikshna Dumanam, Kadu Besaja, and also Nasim with oil prepared as Rasanjanam, Adivisham, Mushtam, Devadaru, and Kritam. Especially Kavala by Musta, Pata, Katfala, Kaduka, Vacha, and Chitakashayas. In Sira Virachanam also advised by our Sushruta. Krimikana Aushadas for Yapana Sikicha is also useful in Visaja Sikicha. We are going to the Nasya. Nasya is important therapy procedure in the Pradeshaya and common cold. If it is continually recurrently affect the patient, especially in Pradeshaya, the Nasyam can be contributed to 33% of the total therapy. This is the true of real sense after so far Virachana Nasya is considered. In condition like the chronic sinusitis, this aspect has been proved the pipes. Nasya, when used in Vadaja Pradeshaya, which is produce a better result than other Sannipadaja, Kaphaja, and Pistaja and Dattaja conditions. The most of the Nasya which is it indicates the Pratishyaya which should be in Thailand. For identically the Gritham, some cases we can advise Gritham also. Among the all thylas, Tilathyla is the best one. It's the ideal one, which is possesses so the properties there. So because of that, in any type of, if we have any doubt about the condition, types of nasya or any other type, don't worry about that. Please use Tilathyla. Next. Nasya Sicha and modern view. Nowadays, it is clearly correlated with modern as well as in Ayurvedic. One of the principle which is nasal drops, especially in condition of Pratishyaya, vasomotor especially in sinusitis, it's nothing but a deconstruction. So our Ayurvedic nasya, the most of the nasya drugs, it is a thyla medium. It's medicated with the mrudu dravyas, mild, satisfactorily following its condition, which is need to the deconstruction. Next. It's also prompt reliable action, and also secondary and rebound conditions should be, of course. Side effect is very less, and also the duration of action should be firmly long, and also frequency and application. Application of Nasyam is very easily administered. Even the patient also administered. So that's very by the help of the attenders, they may use the Nasya Karma. So that's why it is easily advisable correlated with the modern. In Nasya Chikicha, especially in modern, the solution or preparation of the application should be, it should not be irritant and harmful to the. So because of the Nasya drug, medicated substance or Mrudu drugs, definitely it is hopeful to the condition. Next. From different studies in the, especially the systematic absorption of which is happened through the mucous membrane of the nose, if Nasi is given in oil medium, the absorption rate can be improved of the mucous membrane, and also it's much useful in the rich agri. Next. We are going to the Patya. What are the Patya? Rest. Rest is very must, and also the working place, which is free from the direct wind, and also wearing of heavy as well as warm clothes and vapor around the head. That's very important. So அதனால தான் வந்து அந்த காலத்துல வந்து தலப்பாகை அப்படின்னு ஒரு இருக்கு. அதாவது எல்லா ட்ரெடிஷன்லையும் அந்த தலையில வந்து வித் நம்ம துணியால ஒரு கிரீட மாதிரி வச்சிருந்தாங்க. பிகாஸ் ஆஃப் தட் ரீசன் ஒன்லி. Then it is usually which is dry. We may use dry as well as barley meal may be advised. But the patient of Pratishyaya should keep away from food, especially avoiding sexual intercourse as well as which immersion of the bath water, tub bath water. The worries as well as excessive dry food, which is suppression of natural urges and grief, or especially freshly prepared intoxic food. That is contaminated food. It is also. Then Patyam, based on Agara, Kadomla Lavanarasa, especially Jangla Rasas, and Purana Yavashali, as well as Lagu Bhojanam, and Pulata, Shiguru, Karkataka, Lashunam, Puranadati, as well as Varuni Katu Trivias. It is also used in Agars. Whereas in Vikara, Sneganam, Svedanam, Sirobhigam are Patyas in commonest condition of Pratishyaya. Next. Then we are going to the Apatyas. If you administrated Dravya Agaras, definitely it will increase the Pratishyaya. So please avoid that. Then Snana, Krodam, or especially Vegam administration, and Bhumi China. Arela Paduthu Tungu Kandipa Kodai. Okay. Next. We are going to the formulation. What are the formulation? The oral administration in may be taken with the honey, especially sufficient honey quantity. It makes paste formation. 7 to 15 ml juice of adragat twice a daily. It's very important after food. Okay. It's an important duration. Next one is a common, even the Naga Bulika we used in all types of religion, especially 1 to 2 or 3. It is taken with a 7 to 14 ml juice of tulasi, and also 16 to 120 milligram of powdered bark of Katpala twice a daily after food. This is also another formula. It is useful in Pratishyaya. Then both in the there's 2 to 4 tablets. It's based on the age as well as bala of the patient. 2 tablets twice daily with decoction of tulasi or tea made up of with tulasi, which is along with the ginger. It's excellent remedy for Pratishaya. Next one. Dashamula Kadutriyadi Kashayam. The best Kashayam for Pratishayam is, according to me, Dashamula Kadutriya. Based on my practice, Dashamula Kadutriya Kashayam, which gives tremendous result to the patient, 10 to 20 ml. It's based on the age as well as weight of the patient and the condition of the patient. Twice daily, empty stomach, that is before food, boiled with warm water. But we may mix it with the Tribhuvana Kittiras along with the Dashamula Kadutriya Kashayam. It is excellent combination in Pratishaya. Next. Gorochana refills, 1 pill is mixed with 10 ml of Dashamala Kadatriya Kashayam. So based on the Kashaya dose, we will decide the dosage of Gorochana refills, especially which twice daily on empty stomach. Okay. Then Chikum Piplayadi Gurika. Chikum Piplayadi Gurika, 1 to 2 tablets twice daily mixed with ginger or tulasi, especially sufficient quantity. It is after food, which gives normal digestion as well as which induce a upgrade. Okay. Next one. If it is in Vata type, specifically we can administer the Rasanadi Grutam or Vidari Gandhadi Ganam or Panjalavana Grutam or Panjamula Grutam because of Rokshatum, we are ruining that. But Satapwadi Duma Pranam also we can administer it. One of the famous medication, the Sina Oil Labs medication, it is excellent in Vata position. This is the excellent position. Then we are going to the Pittaja. The Pittaja Raktaja almost the same. The pressure that the treatment is Kakulyadi Gritam or Madura with the Tikta Gritam or Chudi milk and ghee, the combination of this, and stick the Madura Virachanam, and also cool item because the Pitta and Rakta is more hot nature because of the patient. The cool items are eating as well as drinking. We can use that. The cool application of Lapasapam, especially on that. The secum with Chandana, Ushire, and Amalaki, etc., which is application over the and whenever the patient may have very hot pain, we can use administration. Next one, Kafacha Pratishyaya. If it is Kapata Pratishyaya, the oral administration of Kapfadi Churnam, Vyoshadi Vati, Gudam, or Maricham with hot water, or Nasi with Baringyadi Thailam. It's the best medicine. If it is Prokopita Kafaja Pratishyaya means definitely we use administered to Nasi with Baringyadi Thailam, and also hot water, which is using drug, even drinking water as well as bathing. You can use hot water. Cold application, it's not advisable that, but the application of Lepa with the Sveda Sashaba Shiru Lepam is administered. Then external application, although there, prepare the Nasi drug, which is powder of Shundi and dried ginger, 600 milligram in 5 to 10 ml of milk, and 2 to 4 drops is based on the dependent upon the patient installed in the nose. It is useful in the stuffing of the nose, and also the same condition nasolarin based on the Sagar pharmaceutical company. It is excellent application for administering the Pratishaya. Next, Rasanadi Churna, we know it's very important. It is applied over the head, around the forehead, and also stuffing into the nose. Frequently, it may relieve the Pratishaya condition. This is excellent application. In Kerala Ayurveda pharmaceutical company, statin is that whenever the patient having a nasal contraction, if you administered a statin tablet, 1 tablet thrice a day, definitely it gives tremendous result on the condition. Next, the black turmeric rhizome, which is dyed with dried amla, which is mixed with a pinch of black pepper, which is applied over the forehead, and also the form of the paste made with the dust milk. It is useful in external application of the Pratishaya. Likewise, in Zandu pharmaceutically, they prescribe the poison. It's excellent medicine, especially in running nose. Continue running nose is that you can administer this medicine. Another simple kitchen remedy is based on the decoction of equal part of draksha, maricha, and especially leaf of vasa along with estimado. 14 to 28 ml is to be taken with 5 to 10 milligram chakra of raw country sugar thrice a day. Definitely, it's control the condition. Then the tablet Alarin, it's from Band Laboratory, which is most useful to us in whenever the patient getting nasal contraction, you can administer it Alarin tablet along with Brusol NS. Decoction of the tulsi leaves as well as ginger 15 ml mixed with 1 milligram black pepper powder. It may be taken twice a day. It's oral administration. Next. The complication of Pratishaya, already I mentioned that improper management of Pratishaya, which leads to severe complication like Badhirya, blindness, and also it creates a lot of complication. If it is not properly treated, it will cause the mucus changes in the nostril as well as the result in the terminate hypertrophy and epistaxis. Like many other diseases, especially immunoglobulin factor, and also play the vital role in the development of recurrence as well as the corrective aspect of the Pratishaya. Identification of aggravating factor, allergen is the first step to treatment administration of Pratishaya. Rightly said that the Ayurveda also Nidana Parivachana. Next. I think it's the end of the session. Thanks. Thank you, friends. Thank you very much. Thank you very much too. I ask Ayush.
Thank you, sir. It was a wonderful session. And we'll have some breaks for question answer session. Audience are requested to post their questions in the chat box. The doubts from my side, sir.
Okay.
So, first of all, sir, can Jalaneti can be advised in this condition, sir? Jalaneti.
It's if it is a very chronic condition, we can administer it. Otherwise, in Nava, don't advise them.
Ama condition will restrict the Jalaneti acid.
Yes, ma'am.
So, what can be all the differential diagnosis of Pratishyaya, sir?
Actually, differential diagnosis, especially sinusitis. Actually, many people they may explain about Pratishaya is a sinusitis, Pratishaya is a sinusitis. Dushta Pratishaya is a sinusitis. If it is involvement of sinus is there, definitely it is not correlated with Pratishaya. That is a complication of Pratishaya. Then laryngitis and pharyngitis, that is also the same symptom is there. But the site of the lesion is it's not in nasal pathology, it almost in laryngeal as well as pharyngeal condition. In otitis media, in some cases of otitis media also, like it is the symptoms like Pratishaya, but it is not that, it is a secondary one. So almost the differential diagnosis, we can easily find out the Pratishaya patient from the other conditions.
So, but we see in this Pratishyaya and also in sinusitis, both have running nose, both have itching near the inner canthus of eyes, both have blockage in the ear. So, what can be the exact pronunciation, sir?
That's why in modern people's nowadays, actually previously rhinitis and sinusitis is separate one, but nowadays because of the pathological stages, they are merged with that rhinosinusitis. In beginning stage, we have to treat with the rhinitis. It is in chronic stage, definitely we are administrated like a, we can treat the patient like sinusitis. So based on our Ayurvedic, based on my practice, I can see Vadaja, Pittaja, and Kaphaja because most of the people they may come to my clinic on chronic level, especially in Sannipadaja type or otherwise Doshic type. So definitely it is associated with rhinitis along with sinusitis. So we have to treat like those. Almost the Sannipadaja treatment is must nowadays.
Sir, as atmosphere also plays an important role in Pratishyaya,
Yes,
so the
already
person
yes, because already I mean cosmetic factor or Nidana Paricha because nowadays the modern lifestyle, even though it is winter season, many of the people using air conditioned room and also the urbanized condition, even though village sites also lot of dust and pollution is there. That's the irritating factor, which is the important costly factor to produce Pratishyaya.
So what can be the management, sir? If the person's living near the cooler regions, what can the basic things which they can take care of?
Even though the affected person or healthy person, please practice nasya in regular manner
Anutaila
along with
practice.
the dinacharya. As Anutailam is must. Or
Okay,
if it
sir.
is not there Anutailam, please use plain
Tilathaila.
Tilataila. Tilataila is must.
There is a person of chronicity of around 5 to 8 years, and that person particularly using steroids like dexamethasone. In that age, a person is approaching to a Ayurvedic management.
So
How
first
can we make
we
him
have
as
to.
a doctor?
Yes, yes, I understand that. Many of the people, especially corticosteroid, somebody's maybe having a continue antihistamines medicines. If you continually administrated the antihistamine medicine, definitely they may addict to the patient medicine. If first we'll treat the sodhanam, sodhanam is must. Then only we can administrate the Pratishaya therapy. Otherwise, it won't be. It gives bad result.
Sir, as even I have this problem in there is if some suppose if I'm supposed to like exposed to an allergen, sudden anaphylactic access happens to me. I sneeze about 10 to 15 times without anything, sir, and I have severe running nose. So, what can be a sudden management to stop the
Actually,
sneezing, sir?
actually,
That makes me too much
don't
irritated.
stop the sneezing. Don't stop the sneezing. We, as an Ayurvedic doctor, you know that it's a natural urges. If it is properly eliminated, it won't be give further complication. If it is suppressed, definitely it cause lot of complication. But the same symptom is continuously occurs more than 1 week. Definitely we can administrate it Pratishaya. Otherwise, leave the treatment because the Pragopita Kaphadosham, it should be eliminated through nasal. This is the only way of elimination from the head, especially compared to the mouth வழியா வரதை விட nasal வழியா தான் ரொம்ப ஈஸியா எலிமினேட் ஆகும் பிகாஸ் ஆஃப் த pathway of கஃபா. அதனால நார்மல் கோல்டு இருக்கு, ஸ்னீசிங் இருக்கு அப்படின்னா இமீடியட்டா சப்ரஸ் பண்ணாதீங்க. அலோபதி டாக்டர்ஸுங்க ஈவன் பப்ளிக் என்ன நினைக்கிறாங்க, கோல்டு வந்தா இமீடியட்டா ஒரு டேப்லெட் போடணும், போட்டு வித்தின் 3 ஹவர்ஸ்க்குள்ள நார்மல் ஆயிடும். அது அந்த டைம்ல நார்மல் ஆகும், பட் கொஞ்ச நாள் கழிச்சு அது திரும்ப அக்ரவேட் ஆகிட்டே தான் இருக்கும். அது அவங்களுக்கு தெரியாது. அதுதான் பப்ளிக் செய்யற மிஸ்டேக். ஒரு 7 டேஸ்க்கு அப்புறமும் கண்டினியூஸா இரிட்டேட் இருக்கு, இல்ல ஒன்ஸ் இன் வீக் ஆர் ட்வைஸ் இன் வீக் ரெக்கரண்ட் இருந்துகிட்டே இருக்குன்னா தென் வி ஆர் கோயிங் டு த ட்ரீட்மெண்ட். அதர்வைஸ் டேக் ஹெல்த்தி மெஷர்ஸ். ஸ்னீசிங் இருந்தால் லைக் தூமணம் எடுக்கலாம், நார்மல் ஹெல்த்தி ட்ரீட்மெண்ட் இருந்தால் ஆறு சிம்பிள் கஷாயஸ் எடுத்துக்கலாம், அவ்வளோதானே தவிர சப்ரஸ் பண்ண வேண்டாம். ப்ளீஸ் சப்ரஸ் பண்ணீங்கன்னா டெஃபினெட்லி இட் அக்ரவேட்ஸ் கண்டிஷன்.
ஓகே சார். சார் இப்போ கிளினிக்கல ஐஜிஏ ஜாஸ்தியா இருக்கும்னு இப்ப நிறைய பேருக்கு ஒரு பிலீஃப் இருக்குல்ல சார். நான் அலர்ஜிக், இதுக்கு அலர்ஜிக், அதுக்கு அலர்ஜிக்னு இப்ப நிறைய விஷயத்துக்கு சொல்றாங்க. சோ அந்த மாதிரி கேஸுக்கு நம்ம என்ன மாதிரி மேனேஜ்மெண்ட் பண்ணலாம் சார்?
இது வந்து வெறும் Pratishaya ட்ரீட்மெண்ட் மட்டும் பண்ண முடியாது. நம்மள வந்து அவங்களுடைய ஓவரால் இம்யூனாலஜிக்கல் வந்து நார்மல் வர்றதுக்கான ட்ரீட்மெண்ட் லைக் சோதன சமணம் பாலிவேட்டிவ் ட்ரீட்மெண்ட்ஸோட அலாங் வித் Pratishaya ட்ரீட்மெண்ட் கொடுக்கும். செப்பரேட்டா கொடுக்க கூடாது. என்ன ரீசன்னா, பேஷண்ட் வந்து இப்போ வர பேஷண்ட்ல பெரிய காம்ப்ளிகேஷன் என்னன்னா, ஃபர்ஸ்ட் அவங்களே டாக்டர் ஆயிடுவாங்க. இப்போ உங்களுக்கு வந்து ஒரு கோல்டு இருந்ததுன்னா ஃபர்ஸ்ட் என்ன பண்றாங்க, டைரக்டா அலோபதி டாக்டர்ஸ் எடுங்க. கொஞ்சம் பேர் என்ன பண்றாங்க, இப்போ லாஸ்ட் கொரோனா 2 இயர்ஸ்க்கு அப்புறமா என்ன ஆயிடுச்சு, ஆயுர்வேதிக் மெடிசன் டைரக்டாவே வந்து ஆன்லைன்ல பர்ச்சேஸ் பண்ணி அவங்களே டைரக்டா மெடிக்கல் எடுக்க ஆரம்பிச்சிடறாங்க. அந்த மாதிரி கண்டிஷன்ல இருக்கிற பேஷண்ட்டுக்கு நம்ம ஃபர்ஸ்ட் வந்து அவங்களுடைய இம்யூனாலஜிக்கல் லெவல்ல வந்து நார்மல் பண்ணணும். அதுக்கான மெஷர்ஸ் எடுத்துட்டு அதுக்கப்புறம் தான் பிரதிஷ்டை பண்ணணும். நம்ம பிரதிஷ்டை ட்ரீட்மெண்ட் நம்ம எடுத்த உடனே ஆரம்பிக்கும் போது கண்டிப்பா அந்த ஃப்ரூட்ஃபுல் ரிசல்ட் வர்றதுக்கான சான்ஸ் ரொம்ப கம்மியா இருக்கும். ஸோ ப்ளீஸ் டேக் கேர் அபவுட் தட். பிகாஸ் பேஷண்டோட ஹிஸ்ட்ரி ரொம்ப முக்கியம். அவங்க யூஸ்வலா என்ன பண்றாங்க, எல்லாருமே வந்து மெடிகேஷன், ஈவன் அலோபதியா இருந்தாலும் ஆயுர்வேதிக்கா இருந்தாலும் செல்ஃப் மெடிகேஷன் ஒன்று இருக்கு. யாரை கேட்டாலும் நம்ம கோல்டா உடனே, ஈவன் நம்ம இப்போ ஜஸ்ட் உங்களுடைய ரிலேட்டிவ்ஸ் இல்லை ஃப்ரெண்டு யாராவது மீட் பண்றீங்க, ஈவன் நீங்க டாக்டரா இருந்தாலும் பரவாயில்ல, ஜஸ்ட் ஒரு கோல்டுன்னு அப்படி சொல்லி பாருங்க, அவங்க ஒரு 10 அட்வைஸ் பண்ணுவாங்க. ஸோ அதெல்லாம் பேஷண்ட்டோட இட் மீ அக்ரவேட்ஸ் அ கண்டிஷன் ஆர் இட் மீ சப்ரஸ் அ கண்டிஷன். அப்படி இருக்கும்போது ஃபர்ஸ்ட் நம்மள வந்து அவங்களோட இம்யூனாலஜிக்கல் லெவல்ல நார்மல் பண்ண பிறகுதான் ப்ராப்பர் பிரதிஷாய ட்ரீட்மெண்ட் எடுக்கணும். இல்லைன்னா நம்மளுக்கு வந்து ப்ராப்பர் ரிசல்ட் கிடைக்கும்.
Okay, sir. Audiences are requested to post the doubt sessions. Sir, இப்போ ஒருவேளை if the person already had some COVID attack or pneumonitis, tuberculosis, அந்த மாதிரி some person is coming, and if they have the later on developed symptoms like the Pratishyaya, how can be the management for them, sir? Can Shodhanam can be applied as there maybe the Dhatukshayam will be there.
அது
So
பேஷண்டோட
how the
பலம் ரொம்ப
Shodhanam can
முக்கியம்.
be?
ஓகே, இதுல வந்து பேஷண்டோட பலம் ரொம்ப முக்கியம். அவங்களுடைய லங்ஸோட ஃபங்க்ஷன் எப்படி இருக்கு, அவங்களோட ரெஸ்பிரேஷன் எப்படி இருக்கு, கார்டியக் மதர் ஃபைட்டல் ஆர்கன்ஸ்லையும் நம்ம பார்த்துட்டு அதுக்கப்புறம் தான் நம்ம ட்ரீட்மெண்ட்டை ஸ்டார்ட் பண்ணணும். பட் இதுல ஒரு இம்பார்ட்டன்ட் பாயிண்ட் என்னன்னா, ஈவன் அவங்களுக்கு எந்த செகண்டரி காம்ப்ளிகேஷன்ஸும் இல்லை அப்படின்னா பிரதிஷா ட்ரீட்மெண்ட் ஸ்டார்ட் பண்ணிக்கலாம். ஏன்னா அவங்களுக்கு வந்து ஒரு ஃபர்ஸ்ட் ஒரு விஷயம் என்னன்னா, அவங்களோட கொரோனா வந்து வைரஸ் இன்ஃபெக்ஷன் ரிலீஸ் ஆகி நார்மலுக்கு வந்துட்டாங்கன்னா அவங்களுக்கு வந்து பாலிவேட்டிவ் மெஷர்ஸ் மட்டும் எடுத்தா போதும். அதனால அதுக்கு ஒன்றும் பயப்பட தேவையில்லை. நிறைய பேர் கொரோனா வந்தவங்களுக்கு நிறைய காம்ப்ளிகேஷன்ஸ் வரும். நவடேஸ் வந்து டயபெட்டிஸே இல்லாம டயபெட்டிஸ் வந்திருக்கு, ஹைப்பர்டென்ஷன்ஸ் வந்திருக்கு, நிறைய காம்ப்ளிகேஷன் ஆஃப் டிசீஸ் வந்திருக்கு. அது வந்து வேக்சினேஷன் பண்ணவங்க பண்ணாதவங்க அந்த மாதிரி எல்லா காம்பினேஷனும் இருக்கு. அது இன்னும் ஒரு ப்ராப்பர் சினாரியோ ஒன்று நம்மளால இன்னும் ஐடென்டிஃபிகேஷன் பண்ண முடியல. பட் கொரோனா வைரஸ் வந்தவங்க பிரதிஷாயம் இருந்ததுன்னா டெஃபினட்டா அவங்களுக்கு இம்யூனாலஜிக்கல் லெவலோட சேர்த்து பிரதிஷாயம் பண்ணணும். நான் திரும்ப திரும்ப அதை சொல்றேன். நிறைய பேர் என்ன பண்ணாங்க, ஜஸ்ட் பிரதிஷாயம் மட்டும் ட்ரீட்மெண்ட் பண்றாங்க. அந்த மாதிரி பண்ணக்கூடாது. அவங்களுடைய இம்யூனிட்டி லெவல் இப்போ ஈவன் நம்ம ஆக்சுவலி சவனப்பிரஷ் இருக்கிறாங்க, சவனப்பிரஷ் வந்து பிரதிஷாயத்தில் எடுக்கலாமா, இந்த கேள்வி டெஃபரெண்டா கேட்குறாங்க. ஏன்னா ஒன்ஸ் பேஷண்ட்டுக்கு வந்து அவங்களுடைய இன்கிரீடியன்ஸ் எல்லாம் எடுத்து படிச்சு அவங்களே கூகுள்ல பார்த்துட்டு சார் சவனப்பிரஷ் பேஷண்ட் எடுக்கலாமா, அப்படி இல்லை. பேஷண்ட்டுக்கு அஸ்டப்ரோல் இருந்ததுன்னா பிரதிஷாயத்துல கண்டிஷன்ல கூட சவனப்பிரஷ் எடுத்துக்கலாம். பட் சம் கேசஸ்ல வந்து சவனப்பிரஷ் ஆக்சிஜன். ஸோ இந்த மாதிரி ஒவ்வொரு ட்ரக்கும் அவங்களுக்கு டிஃபரன்ஸ் வர டவுட் வர சான்ஸ் இருக்கு. எப்பவுமே நான் என்னுடைய அட்வைஸ் என்னன்னா, ஈவன் கொரோனா வந்தாலும் சரி, ஒமிக்ரான் வைரஸ் வந்தாலும் அவங்களுடைய வைட்டல் ஃபங்க்ஷன் இப்போ எப்படி இருக்கிற பிரசன்ட் கண்டிஷனை எக்ஸாம் பண்ணிட்டு டெஃபினெட்லி வில் அட்மினிஸ்ட்ரேட் தி பிரதிஷா ட்ரீட்மெண்ட் அலாங் வித் இம்யூனாலஜிக்கல் பூஸ்டிங் மெடிசன் லைக் ஈவன் அகஸ்திய ரசாயனம் கொடுக்கலாம். ஈவன் அவங்களுக்கு ஒமிக்ரான் வந்திருந்தாலும் சரி, ஈவன் அவங்களுக்கு ஒமிக்ரான் கொரோனா வைரஸ் எந்த டைப் ஆஃப் வைரஸ் வந்திருந்தாலும் சரி, அகஸ்திய ரசாயனம் வந்து பெஸ்டான மெடிசன். ஏன்னா என்னுடைய லாஸ்ட் 2 இயர்ஸ் என்னுடைய பேஷண்ட்டுக்கு எக்ஸலண்டான ரிசல்ட் கொடுக்கும் அகஸ்திய ரசாயனம்.
My next question was அகஸ்திய ரசாயனம் வந்து எந்த அளவுக்கு பிரிஸ்கிரைப் பண்ணலாம் அந்த மாதிரி கேஸ்ல சொன்னதுக்கு வந்தது சார், and you had the answer for that.
Okay. ஓ, மூணு பிரேயராவே ஆன்சர் சொல்லிட்டு.
Audiences are requested to post their doubts in the chat box. Thank you so much, sir, for such an elegant session. You have explained in a so simple way so that even the beginners can understand what actually the Pratishaya means. I think it will be an eye-opening session for many practicing doctors and even the budding students like us. And even you made us to understand many things for common people who doesn't have a medical background. And we are looking forward for various sessions with you, sir, in the future. Thank you so much, sir.
Okay, once again, thank you to Dr. Ilanjayan and team, and Ayash Ayush team. Thank you very much. Thank you for the opportunity.
You must be the change you wish to see in the world. Work accordingly, create a success history of yours. Thank you so much, sir, for your valuable time. I thank all the audience, doctors, on behalf of Ayaska Ayush, our streaming partner Vijayaragavan Coimbatore, and sponsored by Dr. R. Ramesh, Daya Ayurveda Treatment Center. Thank you so much, sir.